A fever is a temporary rise in body temperature, usually as a sign that your body is fighting an infection caused by viruses or bacteria. A normal body temperature is around 37 degrees Celsius (98.6 degrees Fahrenheit), and a temperature of 38 degrees Celsius (100.4 degrees Fahrenheit) or higher is generally considered a fever. Fever is often accompanied by chills, sweating, headache, body aches, tiredness, and loss of appetite. In most cases, fever is not a disease itself, but a symptom of an underlying illness such as a cold, flu, or other infection. Most mild fevers improve with plenty of rest, drinking enough fluids to prevent dehydration, wearing light clothing, and taking over-the-counter medicines such as paracetamol or ibuprofen, when appropriate, to reduce fever and relieve discomfort. Seek medical attention immediately if the fever is very high, lasts more than 2 to 3 days, is accompanied by severe headache, difficulty breathing, chest pain, persistent vomiting, confusion, seizures, a stiff neck, or if it occurs in a very young infant. Remember, treating the fever may make you feel better, but it is also important to identify and treat the underlying cause.